So, hello everyone. On behalf of SRHM, Sexual and Reproductive Health Matters, the School of Public Health, University of the Western Cape, I am really pleased to welcome you to our webinar today to talk about a new upcoming themed issue on queering health systems. I'm Sapna Desai. I am the editor of the journal SRHM, and I'm joined by colleagues from SRHM and the specific themed issue, and everyone will be coming one by one in a few moments. So I won't introduce everyone now because you'll see all of us. We're very excited. In the chat, you'll see that we have asked people to let us know where you're joining from so we have a sense of who's here. It looks like people are still streaming in already. So we'd love to hear where you're from. As we go through, so I'm going to first tell you a little bit about SRHM for those of you who may not know. Jessica, do you mind moving the slide? Thank you. So SRHM, Sexual and Reproductive Health Matters, we are an organization that really our main mission is to advance the creation and dissemination of knowledge around sexual and reproductive health that's grounded in human rights. A big focus of our work as an organization and as a journal is to facilitate knowledge to action, to ensure that evidence, the way in which it's generated, the way in which it's used, is firmly grounded in action, both through the processes of the actual creation of evidence towards, as well as towards its use, towards improved sexual and reproductive health and rights. We've had a long history as a journal. Jessica, if you could move slides. We've had a long history of a journal for over 30 years now as a peer-reviewed open access journal that we focused on a huge range of issues around the field of sexual and reproductive health and rights. And for those of you who have been reading the journal, you'll know that we have often been, there's some noise coming, sorry, but we've often been ahead of the curve in many ways in trying to identify new and emerging issues in the future. And I think this themed issue we're about to discuss really exemplifies that, looking at issues that people are not talking about, that people should be talking about, but that where we really need credible evidence to influence action as well as to influence future research and policy change. So one of the things we do as a journal is, in addition to publishing our peer-reviewed articles, of which there are many types, which you'll hear shortly, and our new publishing platform, which is now a self-publishing platform, we also try to generate dialogue around what's emerging. So alongside this journal issue, we will be doing webinars, sessions, different events to ensure that the knowledge doesn't stay just in articles as well. And one of the things we do, as you can see here, we publish open issues in our open access journal, which you'll see online, but we also publish over the years a series of themed issues. If you could go to the next slide, please. And I'm going to turn to senior editor and actually founding editor, co-editor of SRHM as well, Sundari Ravindran, who will also be working very closely on this issue to tell you a little bit more. Over to you, Sundari.
Hi, I'm delighted to be here and to introduce to you this upcoming themed issue. As Sapna mentioned, each year SRHM publishes an open issue where articles related to a wide range of sexual and reproductive health and rights topics are published throughout the year. In addition, SRHM usually launches themed issues in partnership with external associates, focusing on particular SRHR issues. And we put out a specific call for proposals. And all article types, as in the open issue, are accepted, such as research articles, reviews, commentaries, perspectives, policy and practice papers, and so on. And so you'll see projected a whole range of themed issues that we've had in the past. One happening simultaneously with this is a themed issue on trans and gender diverse healthcare that many of you may have heard about. And we've also had specific regional issues and issues, as Sapna mentioned, that are contemporary concerns such as donor funding for SRHR advocacy or the lack of donor funding for it, self-care interventions, about the global gag rule, and so on. So we're delighted to have with us, to feature the themed issue on queering health systems. And Asha and her team will tell you more about it. Over to you, Asha.
Thank you. Thank you, Sundari. I'm really excited to be here. I'm Asha George. I'm at the School of Public Health at the University of the Western Cape. And it's such a wonderful opportunity. I see some colleagues who were on the consultation at the beginning of the year, and old friends, and new colleagues who are coming to this conversation. Before I start, I just wanted to go over a few ground rules. We know this is a issue that it's always been a long-standing sexual and reproductive rights issue at the forefront of certain fault lines, but it is also something that's currently very politicized, and a lot of passion goes, it affects people's lives, their rights, and there've been different developments in terms of we're coming at it from different fields. So I think it's an opportunity. The aim of this issue is to address silences, unpack assumptions, but really to create a learning space to work across the disciplinary silos and bring people from different fields together. And in that sense, I'd really like to welcome a tone of engagement and respecting one another, even if we sometimes use language. Language is very political, always, but in particular with the issues we're going to talk about. So really to encourage a listening tone, and the underlying aim is to be respectful of one another, despite the politics that's happening in the world. Next slide, please. A little bit, and this is linked to that. I know that public health has a history and a tradition of labeling populations that is very problematic, and that applies to this field of SOGI or LGBTQI populations. And we know that each region has its own language. So the terms we use here are not meant to be exclusionary. And I think part of queering health systems, and my point of departure is actually Foucault, is to look at what is in a label, who is doing the labeling and why, and to keep that as an underlying principle in our conversations today, and hopefully that the special issue will spark further conversations moving forward. So a little bit about health systems. We're coming at this from different fields. I wanted to just say, for those of us in health systems, I wanted to just give a little bit of background. Jessica, if you can go to the next slide. Some people know health systems as the overarching framework in our field has been the WHO building blocks. And so people tend to think of health systems as healthcare services, all the things that go into delivering healthcare services. That means financing, medicines, health workers, information systems. And in a way, that has been an important framework. But there's been a lot of social science input into the field. And therefore, there is also, the field has evolved to look at politics, values, how actors come together to affirm health. So it can also be education. How do education systems change how we think about health or promote health? It doesn't always have to be healthcare, or how legislation, parliaments, how they legislate certain rights, and how does that affect health outcomes. So it can be any sector, not just healthcare services. And it's very mindful that health systems are shaped by the social context, and different actors have to come together to support implementation. And in our field here, there might be certain actors that are blocking implementation of progressive legislation and services. So that's just a very rapid overview because we want to hear from you. I just have two other slides to just provide that background. I think it's striking to me. I've been working in health systems for over 25, 30 years, is that despite it be having this progressive trajectory, I think as a field, we've been complicit in silence around SOGI-esque concerns and LGBTQI populations. Despite the influence of social scientists and a broad commitment to health equity, some people in our field are very much involved in the people's health movement with various progressive social movements. And some of our thought leaders, including myself, are not heterosexual. But nonetheless, I think coming from public health and health systems, we have been particularly silent given the political backlash that is happening, where we're seeing a reversal in legislation criminalizing certain populations, a drastic cut in funding. This has had devastating consequences for human rights defenders in this field and just basic access to healthcare services and changing norms in communities. And I think public health and health systems, they have always been activists in sexual and reproductive rights who have been working on this issue. But I think it's a time that we bring together people from different fields to actively support health and human rights, looking at queering health systems to create truly more inclusive systems. So I had a last slide on queering. Each of you will have your own interpretations of what this means, but what I like about using queering health systems as our entry point is that it is trying to question. It is trying to question the norms, the ideologies that shape our field. How do we think health systems and health services should work? What are the entitlements to rights? How do we think about social movements, trying to change how health systems are organized, how health providers respond to people? And I really like that lens of disrupting how what we think and take for granted as normal and how inequalities are normalized and really look at those assumptions. And I think that to me is key because it's questioning the assumptions, looking to open up the frontier of how do we think about health systems? Are there other ways of thinking about health systems so that they bring in marginalized voices for it to be truly inclusive for specific populations, but also for broader populations as well. I'm really excited to be working with Humphrey and Feeney in this collaboration. They each bring their own perspectives and they'll be the guest editors. So I'm going to hand over that to Humphrey and Feeney next. And we look forward to hearing from you as well. In terms of opportunities, we're kicking off a 2-year process. So apart from the special issue, if colleagues have ideas of events, of things, how do we engage producing a high quality journal issue, but also opportunities to engage, to raise the issue to advance social justice. Over to you, Humphrey. Thank you.
Thanks, Asha, and good afternoon, good morning, good evening, colleagues. So my name is Humphrey Ndondo. I am a co-guest editor for the special issue on queering health systems with the Sexual and Reproductive Health channel. So, and I like how you've opened this session, particularly around this session to queer health systems. We are really putting out to colleagues that the disclaimer on language and how we're using SOGIs and how we're using LGBTQI plus language is really our true intention to be inclusive, and we appreciate that this is not exhaustive, and sending out an open invite for colleagues to engage with this discourse in ways that they best understand from their sociocultural, political, and historical context, and bring contributions that critically engage with this language and reflect their locally grounded and decolonial expressions, and send a self-identification and also community knowledge systems, including where the language may challenge dominant narratives within the health, academic, and legal frameworks. So I will not dwell on that, but particularly wanted, Finny and I are going to particularly speak to the different topics that we have put together as a team. There was a consultative co-creation workshop that the team conducted with various scholars from academia, from the policy environment, and also from the community leadership that guided us in entailing which pillars we should be working with. The first pillar of the 6 pillars we're going to discuss speaks to diversity, equity, inclusion, and belonging, and is really about disrupting normativity and reimagining foundation. And as I present today, I want to share that we already have shared these specific asks within the call to particularly guide what we will be sharing, and invite colleagues to engage with this presentation even beyond what we share today. But this is to make emphasis around that we're really using political querying as a political and analytical tool to critique that health systems are not a neutral phenomena, that we have seen our cisnormativity, our heteronormativity, and binary frameworks influence health systems. So we are thinking about how health system is affected by legal and policy frameworks, how the governance needs to be critiqued, who is leading the implementation of the healthcare service, how is it tailored, how is our health service delivery for queer persons implemented within various environments in the community, also in public sector pharmacies, etc. And who owns the knowledge system? Who owns the production of knowledge? And how is knowledge, attributed to the lived experiences of individuals, and also to, if it's academic, to their role in writing up about their narratives. The call invites also work that reimagines inclusion based on sexual orientation, gender identity, and other sexual characteristics and traits. It also invites integration and explorations on integration and universal healthcare, dignity, justice, and diverse lived experiences. And lastly, perspectives that are non-critical, and how this can be leveraged to advance inclusion. So those are just some of the elements that we're inviting colleagues to speak on. And we have an open caveat to say, if you have an inkling that you have a paper or an abstract that you think particularly speaks to the theme, and as I read, it's not really adaptable to that, you are open to sharing it for the editorial team to consider. Next slide. So the second topic is around how queering health system addresses structural barriers, and so is around how health workforce transformation and provider competences are viewed. So this topic explores what it takes to achieve sustainable transformation within the sector, moving away from day-to-day pilot programs, small grant siloed work, into changing the dynamics of the implementation of broader scale, more sustainable work. And we're inviting papers that particularly speak to addressing integration in the public sector healthcare system, particularly talk about sustainable financing, institutional culture, service model, strategies for scaling, sustainability, and also including the use of curriculum for reform and continuous professional development, elements of task shifting, to ensure sustainability and elimination of stigma, discrimination, and violence. The last one before I hand over to my colleague, Fina, is really around community leadership, agency, and accountability. And this particular one I'm talking to, this topic will center the role of LGBTQI persons and communities and their leadership in shaping health narratives and healthcare systems. And it will explore our experiences with community-led monitoring, with social accountability mechanisms, with advocacy and co-creation of services, and also interrogate power shifting towards affected populations, and also how decisions are being made and some of the process for decision making in different ways within the health system we create. Fini, I would like to turn this over to you. Thank you.
Thanks, Humphrey. My name is Fini. From Kenya, but based at the School of Public Health at the University of the Western Cape in South Africa. I'll speak about the remaining 3 themes. The second topic which is about how queering health systems addresses structural barriers and health inequities. This topic invites papers that engage with our current political landscape, currently marked by criminalization of LGBTQI populations. We're seeing shrinking space for advocacy and activism, and an emboldening of anti-gender movements. So submissions under this topic can engage with how this restrictive legal frameworks, funding politics, geopolitical pressures are shaping the visibility, safety, and access of LGBTQI populations, especially in the Global South. However, beyond these constraints, we're also interested in submissions that address strategies that demonstrate the agency of communities, resistance, solidarity, and how communities are navigating these hostile environments. The third topic on queer affirming models of care and service delivery, the objective of this topic is to shine a light on what works in establishing queer affirming care in a way that foregrounds bodily autonomy, agency, informed consent, the basic principles of healthcare systems. So in this regard, the contributions that can be submitted under this topic can address service delivery models that showcase, for example, how health engage with gender diversity, adolescent sexuality, how they provide gender affirming care, reproductive health, how they provide reproductive health services in ways that heteronormative assumptions, how they implement educational reforms or health promotion services. We are also interested in approaches to queering health systems across the life course, for example, in the provision of routine and long-term care. Under this theme, we are also interested in alternative healthcare models. For example, how is mHealth deployed to support service delivery? How are traditional and community-based approaches being considered and integrated in queering health systems? Finally, the final topic is about data justice, measurement, and visibility. This topic is really about epistemic justice. It addresses the ways that existing knowledge systems shape how those with marginalized sexual orientations and gender identities are recognized or erased in health data systems, and consequently how this can affect inclusive and equitable planning, financing, and health service delivery. We welcome submissions under this theme that address inclusive and exclusionary data practices, for example, with regard to decisions around data disaggregation, how choices about indicators are made, what is ethical data governance, and what are ethical data systems. For example, what are experiences with evidence generation? We welcome work that explores experiences with evidence generation, especially in contexts which have restrictive legal and policy environment. What does ethical data collection and dissemination look like? Submissions under this theme can also examine how knowledge is produced, how data is collected, who decides which data is collected, what stories are told, by who, how data is disseminated, and how do these choices and practices elevate or deepen understanding or misunderstanding of the diverse experiences of LGBTQI persons? And how do these practices enable inclusive care or expose individuals to surveillance or harm within health systems? I'm going to pause there. Okay. Over to you, Pete.
Thank you. Hello, everyone. My name is Pete Chapman. I'm the managing editor of SRHM, and I'll be point of contact for people who would like to submit their proposals. So I'm just going to talk now about the logistics of the call for proposals and sort of what we're looking for in terms of how to go about submitting proposals. I think the key element to emphasize here is that what we're asking for at the moment with this call is for a proposal rather than a full submission. So the way that this themed issue is going to work is that we have our call for proposals open at the moment, and it's open until the 3rd of July. And what we're asking for is for people who are interested in submitting a full manuscript to the themed issue to email us their proposal so that the guest editors and the SRHM editorial team can discuss each of the proposals in turn in a standardized format, and then from those proposals select the ones that they would like to take forward for submission as a full manuscript to the themed issue. And at that point, we'll be in touch with all authors who have submitted proposals to let them know whether they've been selected or not for the themed issue. And those that have been selected will be provided information on and deadlines in terms of preparing their full manuscripts for submission via the online journal platform. But in terms of the proposals, what we're asking for is hopefully a fairly simple and straightforward process. What we're requiring is for people who are interested to download and complete the template proposal form, which is linked to in the call for proposals on the journal site. This contains guided questions that will enable the guest editors and editorial team to assess the merits of each proposal in a standardized way. I think a key thing here to emphasize is that we would suggest that people who are interested in submitting a proposal read the journal's aims and scope and information for authors beforehand so that you have a good idea of what SRHM looks for as a journal, and not just for this particular themed issue, but in general in terms of what we're looking for within each submission, and particularly regarding a rights focus for submissions. So once the form is downloaded and completed, we're then asking for authors to email the form to me. My email address is here, and we can it's linked to on the journal website as well. And then we will collate all of the proposals, and as I say, the guest editors and the editorial team will discuss each of those in turn and select the ones to take forward. Jessica, would you be able to click the link to the themed issue proposal form, and we'll just have a quick look at what we're asking for. Okay, so hopefully everybody can see this, but we'll just have a quick look at the form. As I say, hopefully it's a fairly straightforward and self-explanatory process in terms of what we're looking for. As I say, it'd be great or important to read the aims and scope and information for authors, as this provides information and some detail in terms of what we're looking for. But in terms of the guided questions, first question is really to describe the relevance of the proposed manuscript, and it's really an opportunity for you to let us know why you feel that your proposed manuscript is particularly well suited to this themed issue. And then the next question is to describe how the present work adopts an appropriate rights lens. We follow the links from there to the journal website that provides some information on what we're looking for and what's sort of considered in this in this aspect of the proposal. Then we're looking about whether there have been any partnerships, whether that is sort of geographic partnerships between Global North and Global South or between groups. And in terms of equitable collaboration, and authorship opportunities. And again, there's information on the journal website relating to that element. We'd like to know whether the present work is part of a larger project and how it kind of fits within that project. So if you provide information on that here, that would be important for us to see. As Sundari mentioned earlier, we publish a range of different article types. So we'd like to know which article type the proposed manuscript would be submitted as. Where applicable, we would also like to have a description, this is an important one, in terms of prospective ethics committee approval or exemption and informed consent processes specifically in the study setting. So again, there's quite a lot of information about this on the journal website, and we won't go into too much detail here, but this is a key element that we want to see, that there has been formal ethics committee approval or exemption as appropriate for research articles. If there are any questions about this or any other aspects of the proposal, then please feel free to email me at any point. Again, my email address is on the form itself and on the call for proposals and the journal website. So if you have any questions at all prior to submission or prior to emailing your form, please don't hesitate to get in touch. Next, we have a question about whether the contents have been published previously. And this is just sort of see that we are, we want to avoid duplicate publication of anything that's been published in other journal or elsewhere. There are obviously caveats to this. For example, preprints don't count as prior publication. So if you've got any doubts about this or where something qualifies as prior publication, please again get in touch and we can discuss that. And then finally, we would like to have the manuscript title, the full authorship list, including affiliations, and the abstract for the proposed submission, up to 300 words. And again, this doesn't have to be a final abstract or even a final author list. We understand that these things may develop as manuscripts are written. And so it doesn't have to be an exact match for what would be submitted should a manuscript be selected. But obviously, we would like as much information as possible to inform discussions and selection. So yeah, that's just a very quick run through of the form. As I say, hopefully it's a fairly simple form to fill in. And just to emphasize again, we're very keen to hear from you. If you've got any questions, you're not sure of anything, please don't hesitate to get in touch and we can discuss any elements.
I think on behalf of all of us, I'd like to really thank you. I'm just going to ask Humphrey and Feeney if you have any closing words or anything you feel that wasn't covered. Over to you, since you are our guest editors for the themed issue.
I think from me, the one thing I would like to add is about how the priorities, the topics that we've talked about are both informed by the consultation that happened prior to the call being launched. But there is a statement in the call about if these priorities the topics themselves do not reflect a priority that you think needs to be included under the theme of querying health systems, you're welcome to also submit a proposal around that.
So I think there is an internet issue there. So I think on behalf of all of us who are working on this themed issue at SRHM and the University of Western Cape, and of course our wonderful two guest editors, we're really excited and look forward to your submissions. So I'd like to just say a big, big thank you. And Asha, you have your hand up. Please, over to you.
No, I was trying to put some, happy emojis, and I realized it's a different interface. So I was like, oh, maybe visually it's combined, but it was only raised. So just thank you, Sapna, SRHM, Humphrey, and Feeney. I was just trying to send some positive energy. Thank you. Bye.
Thank you, Asha, and thank you, everyone, for joining. And please reach out to all of us, Sundari, Pete, Humphrey, Feeney. We're all here and look forward to hearing from you. So thank you.